Ms. Harman.
Thank you, Mr. Chairman. As the daughter and sister of medical doctors, I've seen firsthand the importance and challenges of providing quality medical care. My father treated 3 generations of patients in a middle-income neighborhood of Los Angeles. He believed, as I do, that everyone should have access to good health care. To me, this is a core American value, vital to economic competitiveness and urgently needed. A good health care bill will provide universal coverage, foster competition, encourage innovation, and preserve patients' choice. I strongly believe that a robust public health insurance option is essential to achieving these goals. Neither a single-payer system nor an all-private market approach can achieve the results that competition among a robust public option and market-based plans will, and that is central to this bill. We know what happens when insurance companies don't compete. The results range from complacency to price gouging. A public option will help fix this, harnessing the power of the market to drive down premiums, encourage efficiency and quality, and keep bloated treatment regimens in check. By one estimate, it could save the country $800 billion over the next decade. Clearly, insurers are not solely responsible for the current predicaments. Providers, hospitals, and drug companies must shoulder some responsibility. A health care bill should motivate them to become more competitive and efficient. My father made house calls. Imagine that. Those days may be gone, but innovation can harness American ingenuity to achieve the quality and care and level of excellence this country's health care system was once famous for. Let me just mention briefly 4 issues that I hope will be considered as additions to this bill. First, we must lower drug prices. I believe the provision in Medicare Part D, which forbids the government from negotiating lower prices, is a travesty and should be repealed. I also believe we should consider the reimportation issue. Second, we should bolster surge capacity in emergency medical systems by creating a fast track for military medics to become EMTs. With their recent experience administering trauma care in Afghanistan and Iraq, these veterans are ideally suited to respond to large-scale medical emergencies. I will be offering an amendment that's been developed with Mr. Sarbanes and others on this subject. Third, we must protect DISH funds for safety net hospitals serving indigent patients, something very close to your heart, too. These are a lifeline for big city hospitals, particularly those with trauma centers that bear an unequal burden. And fourth, we should consider raising the exemption threshold for small businesses even further. They are the primary economic drivers in our communities and the key to overcoming our present staggering unemployment rates. Mr. Chairman, every member of this committee knows our health system is broken. This bill charts a responsible course to fix it, and I commend you and Chairman Pallone and your hardworking staffs for your work. Now is the time to demonstrate bipartisanship and courage, to honor our Chairman Emeritus, whose name is on the bill, and to live up to the legacy of this great committee. I yield back the balance of my time.
Thank you, Ms. Harman.